Within my presentation, I'm going to discuss the roles and responsibilities of healthcare professionals. I have chosen to discuss nurses. So, recent changes to the roles and responsibilities of nurses through role expansion. This includes the advanced nurse practitioner role, the drug prescribing role, and also the modern matrons. These are roles that can be achieved via role expansion or via attending university courses. The advanced nurse practitioner is done at university and takes 2 years to complete. From this, a nurse will be able to work in a GP surgery, seeing her own patients independently, or working in the hospital, again working independently or as part of a multidisciplinary team. They are able to work within the A&E department, filtering patients and allowing more free time. Within their assessment, the roles are to undertake an in-depth physical assessment of a patient, to interpret the results of various assessments and investigations that have been done, utilise therapies, prescribe and alter medicines, and can confidently work independent and also a part of a multidisciplinary team. They provide skilled and competent care to their patients. Nurse prescribers. This takes 7 months to achieve at university, and there are 2 types of prescribers: community practitioner nurse prescribers and also nurse independent prescribers. The community prescribers are mainly health visitors, district nurses and school nurses. They work from a much smaller formulary of drugs that they can prescribe, which include bandages, dressings and over-the-counter prescription medications, as well as 13 prescription-only medications. Independent prescribers normally work within a hospital or GP surgery, and they are allowed to prescribe a lot wider range of drugs. It includes medicines within the BNF, British National Formulary. Modern matrons are employed across hospitals and trusts and are specific to a particular area, such as medicine, surgery, theatres, A&E departments, etc. In their chosen area, they are there as a port of call for their nursing staff to go to with any particular problems they may have, as well as being an authoritative figure for the nurses and visitors, patients and relatives. They are providing leadership within their chosen areas, and on a daily basis will deal with problems such as staff shortages and any complaints that may arise. So the impact of these changes. So firstly, let's discuss the advanced nurse practitioner. This role is encouraged by the Department of Health as it offers job progression for nursing staff and meets with the demands of a growing NHS. So in the GP surgery, it allows them to see patients independently and free up some time for doctors to see more patients with more complex needs. Within the hospitals, the A&Ps are providing a service trust-wide. Within the A&E department, they are allowing for patients to be seen much quicker and get filtered through the system much quicker. The A&P will decide whether the patient needs to be seen by a doctor, but can also order x-rays and other things to help diagnose a problem. They can also provide a prescription, allowing the patient to be able to leave the department much quicker. This frees up the doctor's time to see patients with more urgent medical problems. The impact of these changes are mostly met by positives, but there are some negatives, which include the nurses can't do as much as the doctors. Yes, this is true, but they are not there to be underskilled doctors. They are there to be overskilled nurses. Some patients only want to be seen by a doctor. This can make it very difficult for the A&Ps to be able to see patients. However, a lot of this is due to a lack of education for relatives, patients, not knowing what the A&P role can actually do. Once this is normally known, then patients feel more at ease to be seen by a nurse. The impact of recent changes for nurse prescribers is also a job role which is encouraged, as it can help for nurses to progress in their career and to have more responsibility. It allows for the nurses to undertake a serious workload of the doctors. as a lot of doctors are being asked to prescribe simple things such as paracetamol when it has run out on the nurse's discretion side. This is something that a nurse prescriber can simply do, freeing up the doctor's time to see somebody who is much more sicker, or prescribe something that the nurse does not feel comfortable to prescribe, as a nurse prescriber has to be able to prescribe within their set formulary. So a diabetic nurse can only be competent in prescribing things such as insulin. The same goes for if a nurse worked in cardiology, they would only be more comfortable to prescribe cardiac medication. Within the hospitals, it allows for nurse prescribers to take a big workload away from the doctors and complete prescriptions for patients waiting to go home. So it allows for drugs to be prescribed quicker, allowing the patient to be able to go home much quicker, as they are not waiting for a doctor who is a majority of the time very busy within the trust. So the impact of recent changes of the modern matrons. So this is having an impact because it allows for people to be able to see a more senior authoritative figure around the trust, who they are able to discuss any issues they may be having with colleagues or on the ward themselves. They are looking after their area in particular, so they are there to make sure the staff shortages are sorted out, any complaints are dealt with in a timely manner, and that all their nurses are meeting with requirements. It's also someone there when there are busy periods. So it is an extra pair of hands when it is busy. The modern matrons can come into the wards and help to wash patients, give out meals, or also do a drug round. The role of professional bodies for the nursing staff. So we have the Nursing and Midwifery Council, also known as the NMC, the Health and Safety Executive, HSE, the Care Quality Commission, CQC, and the Royal College of Nursing, RCN. So the role of regulating bodies are there to protect the public, promote and maintain health and safety. This is done by ensuring adequate standards are in place for ensuring high standards of care are delivered. It also states codes of practice for healthcare professionals to adhere to, as well as enforcing standards within the healthcare setting. Let's talk about the Health and Safety Executive. They are a national independent regulator who are in charge of maintaining health and safety within the workplace and works in partnership with other co-regulators and local authorities within the UK. They provide mandatory guidelines which are in line with current legislation and continue to research and carry out risk assessments to ensure that the staff and visitors are safe. The HSE doesn't work alone and needs employers, trade associations, professional bodies to play these parts in ensuring that this is done. They investigate to find out the truth of any problems that may arise, why something has happened, and ensuring that it doesn't happen again. In regards to the healthcare setting, the HSE work alongside the CQC, who have taken over a lot of the work for them and the responsibilities. There are many potential hazards within the workplace, including slips, trips, manual handling and sharps injuries. Healthcare is different in England, Scotland and Wales. The NMC are responsible for regulating nurses within the UK. They are in charge of making sure that nurses are getting adequate learning and are practicing the best standards for patient, staff and visitors. The NMC sets out the guidelines from day one. When a nurse first sets into university as a student nurse, the NMC sets out the guidelines of what this student needs to be taught and how they are to be taught it. They keep a register of every nurse who is allowed to practice within the UK, which is accessible to everyone. To be able to practice, a nurse must keep up to date with vital information, and this is done by revalidation, which is done every 3 years. Revalidation includes showing you are continuing to learn through courses and develop these, and then reflect on what you have done within the 3 years. If needed, the NMC will investigate any problems that have come up and will take appropriate action, whether this be extra training or a nurse may be struck off of the register and unable to practice as a nurse. The Care Quality Commission, they're an independent regulator of health and adult social care in England. They set out what is good and outstanding care is and how this is provided. The CQC are there to make sure care providers provide service users with safe, effective, compassionate, high quality care. The CQC monitor and inspect services to ensure that they are meeting with requirements. This is often done by an inspection. It is normally known when they are going to be coming, but there will be an unannounced visit. The findings are then published in a report, and if improvements need to be made, these are clearly published and to be done within a timed period. The CQC will then come back and re-evaluate its assessment and see if the guidelines have been put in place and improvements have been met. The Royal College of Nursing is a professional body as well as being a membership organisation in the United Kingdom.